In this video, we'll do an exam review on beta-2 receptor agonist, beta-2 receptor antagonist, and beta-2 receptors. First, few exam questions and then get the answers after the topic. Question number 1. What's the difference between theophylline and other bronchodilators? Number 2. Which beta-2 blockers are used for short-term and long-term duration? Number 3. What's labetalol and its function? Number 4. What's the difference between ipratropium and other beta agonists? Number 5. What's the difference between metoproteinol and metoprolol? And question number 6. What's the difference between ionotropic and chronotropic effects of beta blocker, calcium channel blockers, and digoxin? Now, beta-2 receptors. Beta-2 receptors are in the heart, lung, liver, uterus, and GI vascular smooth muscles and skeletal muscles. So what's the effect of beta-2 receptor stimulation? Their stimulation causes bronchodilation and vasodilation. They decrease the total peripheral resistance, so they decrease the diastolic blood pressure. They cause smooth muscle relaxation, GI relaxation that decreases the motility. They relaxes the uterus and urinary bladder and used in premature cases of labor also. They also cause lipolysis, increased insulin, and in the liver, their stimulation causes glycogenolysis and gluconeogenesis. So the effects of beta-2 receptor on metabolism is that lipolysis, increased insulin, glycogenolysis, and gluconeogenesis. Beta receptors are activated more by adrenaline, whereas alpha receptors are activated more by noradrenaline. Beta receptors are most responsive to isoproteinol, and the mechanism of action of the beta receptor is that they stimulate adenylate cyclase and convert ATP to cyclic AMP. The other receptor that has the same mechanism of action of stimulating adenylate cyclase is D1 receptor, dopamine 1 receptor. Beta blockers may be hydrophilic or lipophilic. The lipophilic beta blockers, they cross the blood-brain barrier and their toxicity is increased in liver failure. The examples of lipophilic beta blockers are propranolol, non-selective beta blocker, metoprolol, cardioselective beta blocker, and cardiolol, alpha beta blocker. The hydrophilic beta blockers, they do not cross the blood-brain barrier and their action is increased in renal failure. Cardioselective blocker and nadolol, non-selective beta blocker. The beta blockers decrease the mortality in cardiac patients. Why? Number 1, they decrease the size of the infarct and prevent reinfarction. And number 2, due to local anesthetic effect, they have membrane stabilizing effect, especially that of the propranolol. Now, the beta blockers with intrinsic sympathetic activity. So what's intrinsic sympathetic activity is that some beta blockers, they cause presynaptic increased norepinephrine release. So they have both agonist and antagonistic properties. Examples of the beta blockers with intrinsic sympathetic activity are acebutolol, pindolol, penbuterol, celiprolol, labetalol. We have discussed this in other video in detail. Whereas those beta blockers which do not have intrinsic sympathetic activity, they are more beneficial. So what do? The beta blocker without intrinsic sympathetic activity, they decrease the rate of sudden death, they decrease the overall mortality, and number 3, they decrease recurrent myocardial infarction in patients with congestive cardiac failure. Examples of the beta blockers without intrinsic sympathetic activity are propranolol, sotalol, and timolol, the non-selective beta blockers. Now, beta agonists and antagonists. The beta agonist and antagonist may be selective beta-2 agonist and antagonist, non-selective beta agonist and antagonist, and non-selective alpha beta agonist and antagonist. Now, selective beta-2 agonist and antagonist. Selective beta-2 agonists are used in bronchial asthma and bronchoconstriction, and the mnemonic is SMART, S-M-A-R-T, S for salmeterol, M for metoproteinol, A for albuterol, R for retadrine, and T for terbutaline. So these are the beta 2 selective agonists. Albuterol is used for short-term condition, used in acute asthma, whereas selmetrol is beta 2 selective agonist, which is used for long-term duration. The side effects of these selective beta 2 agonists are tachycardia, tremors, CNS stimulation, and high blood pressure. Now, beta 2 antagonists. Beta 2 blockers cause bronchospasm, asthma, and they cause cold extremities due to unopposed alpha 1 vasoconstriction action. Chronic use of adrenergic blockers increases the number of receptors, so they increase the response to catecholamines. So, withdrawal of these agents produce hypersensitivity to sympathetic stimuli, so abrupt withdrawal of beta blockers produce rebound hypertension. Now, non-selective beta agonists and antagonists. Non-selective beta agonists are ephedrine, adrenaline, noradrenaline, and isoprotronol. Adrenaline in low doses decreases the peripheral resistance and decreases the diastolic blood pressure. But in high doses, it causes increase in systolic blood pressure and increase in pulse pressure. So low dose adrenaline causes decreased PVR and decreased diastolic blood pressure because it causes vasodilation. The uses of the adrenaline are in cardiac arrest, anaphylaxis, where it's given in 0.1 to 0.5 mg in a concentration of 1 to 1000, also used in status asthmaticus and in pupillary dilatation. Non-selective beta blockers, example are propranolol, pindolol, nadolol, sotalol, and timolol. Non-selective beta blockers without intrinsic activity are propranolol, nadolol, and timolol. Non-selective beta blockers with intrinsic activity, example is pindolol. Non-selective alpha beta blockers are cardibolol and labetalol. Now, uses of beta 2 antagonists or non-selective beta antagonists. Angina, arrhythmia, hypertension, CCF, thyrotoxicosis, tremors, and glaucoma. And the side effects of the beta blockers are bradycardia, bronchospasm, and low blood pressure. They precipitate heart failure and mask the hypoglycemic features. Beta blockers may also cause hypercholesterolemia, so they increase the low density lipoproteins, but they decrease the high density lipoproteins. Labetalol, which is non-selective alpha beta blocker, causes marked increase in vasodilatation due to marked decreased peripheral resistance because it alpha 1 receptor blocker also. Beta 2 blockers cause cold extremities due to unopposed alpha 1 vasoconstriction. Now, answers to the question, what's the difference between theophylline and other bronchodilators? Theophylline is a bronchodilator also, but it's a phosphodiesterase inhibitor and it's an adenosine antagonist. Which beta blockers are used for short and long-term duration? Albuterol is used for short-term duration, whereas selmetrol is used for long-term duration. What's labetalol and its functions? Labetalol causes marked increase in vasodilatation, that is, marked decrease in peripheral vascular resistance due to alpha receptor blockade. Labetalol is both alpha beta receptor blocker combined. Question number 4. What's the difference between ipratropium and other beta agonists? Ipratropium is anticholinergic bronchodilator used in COPD. Question number 5. What's the difference between metoproteinol and metoprolol? Metoprolol is beta 1 cardioselective blocker used in angina, arrhythmia, and hypertension. It has a negative chronotropic properties that decreases the heart rate and decreases oxygen consumption, and also negative chronotropic decreases the force of myocardial contraction and decreases cardiac output and stroke volume, whereas metaproteinol is a selective beta 2 agonist used in bronchial asthma and bronchoconstriction, and it causes bronchodilation. What's the difference between ionotropic and the chronotropic effects of beta blockers, calcium channel blockers, and digoxin? All these three drugs, beta blocker, calcium channel blockers, and digoxin, have negative chronotropic effects on the heart. Beta blocker and calcium channel blocker are also negative ionotropic, whereas digoxin has positive ionotropic. It increases the force of cardiac contraction, whereas it has negative chronotropic effect along with the beta blockers and calcium channel blockers.